Dr. Sensenig, how are you today?
I'm very good, thank you. How are you?
I'm doing well. Hi, I'm Dr. Ben Reeves, an associate of the Naturopathic Medicine Institute, or NMI, and I'm working toward my Vitalist Fellow Track certification. The NMI envisions a world where enjoying optimal health allows people to reach their highest potential for inspired creativity. It asserts that the highest ideal in healthcare must act in concert with the healing power of nature. And today we have NMI Fellow, Dr. Jim Sensenig, joining us to talk a little bit about the roots of naturopathic medicine, what is the healing power of nature, and why he is involved in the Naturopathic Medicine Institute. But before we get to our discussion, Dr. Sensenig, please tell us a little bit about yourself.
Well, thanks, Ben. I don't know where to start exactly. I'm in private practice in Hamden, Connecticut. I've been here for about 40 years, graduated from National College way back in the last century. I've been the dean of several schools, including National College in Portland, Oregon, and the University of Bridgeport College of Naturopathic Medicine, founder of the AANP, and many of the organizations that organization developed. And relevant to this conversation, founded the Naturopathic Medicine Institute with some of my colleagues a few years ago, actually a decade ago, over our concern that the profession in the last couple of decades is starting to move in a direction that has lost connection with our lineage, and hence our revivification, if I could use that word, of an effort to renew or reconnect with that lineage that has to do with the healing power of nature that you and I were talking about some time ago.
So how do we get reconnected to this lineage?
Well, let's start with the healing power of nature. You know, in the intro there, you read from the mission, or the vision, I should say, for the NMI. And you might recognize those words as a paraphrase of Hahnemann's work about how the purpose of our intervention as a physician is to help somebody reach their optimal level of performance, not just so that they can be healthy, but so that they can use this, he says, this living healthy instrument for the higher purposes of our existence. We paraphrase to say that we can use this for inspired creativity. So the purpose of health is not just to have no symptoms. The purpose of health is to be able to use one's living healthy instrument, use one's mind, body, and soul for the higher purposes of their existence. Right. And this is a completely different way of thinking about medicine than in our dominant culture. So we go back to the healing power of nature. In Vitalist medicine, as opposed to the dominant cultural approach, which is mechanistic medicine, we have mechanism and vitalism. The Vitalist holds that the body is an ecosystem where everything's connected to everything else, and not only on the physical level, but also on higher levels of organization and, dare I say, vibration. You know, our predecessors wrote about the immaterial world and about how disease is reflective of what's happening in that world. But in any case, bringing it down to today's conversation, the Vitalist holds that there's an agency, a power, a force, something at work in living systems, always tending to bring it back to normal, or as Lindlar says, the perfect type. And symptoms, as we see them then in the Vitalist model, are the adaptations and or the manifestation of the imbalance. So if that's true, the only reasonable, logical, rational way to treat symptoms is to restore the balance. That's very different. In fact, it's completely, what shall I say, diametrically opposed to what is being done in the dominant system of medicine, where one treats those symptoms or adaptations as if they are the problem. So when we talk about, when we envision a medicine that's consistent with the healing power of nature, we envision a form of medicine that treats the underlying imbalance, not the symptoms or the expression of that imbalance. And that's where I think we have lost our connection with our lineage or those in the past. I mean, a perfect example is I just saw something the other day. It was on a public radio station, and then I looked up anyway, long story short, it was an article about how a medical practitioner in California was hanging out in grocery stores giving people advice about diet. But the story said that food as medicine is no longer a fringe idea. It's been around for decades. And I thought, decades? I think it's been around for millennia. I believe it was Hippocrates that said something about that, right?
Right.
So we have, in the conventional school, we are now seeing an appreciation for how the environment, including foods, affect things. But let me get back to the question at hand. Mm-hmm. The Vitalist understands or sees that the symptoms, whether it's a headache, whether it's a back pain, in fact, I'm fond of saying, a headache is never a headache. A headache is an expression of something else. Low back pain is never low back pain. It's always an expression of something else. That something else could be an imbalance in the system, so on and so forth.
Right.
We don't have a lot of time to discuss all this. But the reason that we founded the Naturopathic Medicine Institute was, again, because we felt it was necessary to understand how to apply the modalities in the model, or in the, what should I say, the paradigm that those who have gone before have bequeathed to us.
Right.
You know, it's like a lost art, and it's also a lost worldview. When we are being taught or teaching our students or our doctors to treat symptoms in the same way that is done in the dominant school with natural substances, they're still treating the symptoms, right?
Right.
So we're trying to get back to that basic idea. And as some of your other guests have said that I know you've talked to, and we've talked to on the Vital Force or in the Vital Conversation, have said, the public is looking for someone who understands how to put that all together. You know, I've been fond of saying many people think that this connecting with our lineage, so to speak, or our going back to the basic principles of natural medicine is somehow reaching into the past.
Uh-huh.
Well, it is, but we're not reaching into the past to be old-fashioned or to find out how things were done in the past. We're reaching into the past to see what our predecessors gleaned from their experience in the real world, where they were able to articulate or learn various truths. So in other words, we don't go to the ancients to learn what they did, we go to the ancients to learn what they learned, you know, in terms of the truths, the laws of nature, so to speak. Right. And what they've taught us is that health and disease is a natural phenomenon, right? And subject to the same laws as other phenomenon in the physical universe. Uh-huh. Disease is the inevitable consequence of the choices we make in terms of what our internal and external environment is. Uh-huh. Not the doctor's job to just find somebody to treat the symptoms then, but to change that environment. You know, it's been done. If you look at the history of medicine, the people who have understood what I'm talking about, who have practiced and taught this, have done this at great risk, because great personal risk to their reputation, if not their lives, because it calls into question the dominant paradigm in medicine. Right. And in that sense, what they have done in trying to keep this wisdom alive, I mean, there's times when I'm looking at the older books written by many of the authors that you and I have talked about before, from Hahnemann, Kent, Lindlar, Spittler, Wendell, and others. I'm reading these incredibly articulate, deeply philosophical understanding of how health and disease works. And I'm thinking, are we supposed to know this stuff? I mean, doesn't somebody want to keep this from us? I mean, this is like the secret to what health and longevity is all about. Right. So it's clear to me that when we're talking about connecting to a lineage, we're connecting to the wisdom of those who have gone before us. Right. We're connecting with the wisdom of nature, if you will. I think it was Juvenal who said, he's a first century Roman poet, philosopher.
Mm-hmm.
Never does wisdom say one thing and nature another. You know, those are the same thing. Understand?
Right.
So
Right.
that's what we're doing. And if I think about the sacrifices and the what I want to say, the practice and the teaching of what we're talking about here, we have been bequeathed a sacred trust.
Right.
On behalf of humanity, really. I mean, I sound a little religious or esoteric here, but this is the information that someday, I'm going to digress. I was at a conference many years ago with a Native American medicine man.
Mm-hmm.
This was 20 or 30 years ago. And he answered a question that somebody raised by talking about quantum physics. And he said to the listener, or to the questioner, I'm sorry, he said to the questioner, he says, "Oh, you're surprised." He says, "I know what your scientists are doing. And let me tell you something. Someday they're going to know what we know." And I found that very, very interesting, that a Native American shaman was saying that one day our scientists will know what his people know.
Right.
I kind of feel the same way about what we're doing in medicine. Someday what we're doing will be taken for granted as the basic medicine.
Right. Dr. Sensenig, I know we don't have a lot of time, but I think of the vis medicatrix natura and how that came from Hippocrates, and how what that really means is nature is the physician of disease or diseases. And I guess that kind of begs the question, if nature is the physician of disease, then why is the naturopathic doctor essential? If nature is the one that's doing the healing, then how do we study and learn what nature knows? How do we, does that make sense? I know it's kind of a vague question, but.
Well, it does make sense. And I think there's two levels to that question. One is quoting Voltaire, who said, "The doctor's job is to entertain the patient while nature heals." But the other more practical answer, I think, is that in this day and age of so much illness and human suffering, the understanding that much of what we see as disease, which again in our model is an adaptation or a manifestation of the imbalance. Mm-hmm. The disease is not bad or something gone wrong. It's the body trying to adapt to the stresses or the changes in order to continue to live.
Right.
So in this day and age, when we see so much in the way of disease, autoimmune disease, degenerative diseases, chronic diseases, what we need, or I think what our society needs, is a physician who understands that the way to treat disease is to see the whole picture, put that all together, and help the person restore balance in their system. Mm-hmm. I don't mean in terms of lifestyle coaching and other, what shall I say, simple lifestyle changes, but treating the disease, the dis-ease, treating the dis-ease by restoring normal. Your other guests have pointed out that the public is disillusioned with the system that's in place now. Right. And whether that's conventional medicine practice with conventional treatments, or whether it's the so-called, may I say this, Sarah, dare I say this online, whether this is the functional or integrated doctor who's using natural substances in place of pharmaceutical drugs. Right. Still, the outcome is likely to be the same with less toxicity, but it's not naturopathic medicine.
Right.
So again, this is why we founded the Institute, to try to keep this alive, to try to teach this, to try to reunite with those ideas, and to keep that alive by preserving that knowledge, not for our sake, though. It's not for your sake and my sake. Mm-hmm. It's for the sake of those people that we want to help, and those people who come to us for advice. And we all, I think, feel like we're making a contribution to our community, on our nation, and our planet by using the same principles that we use in the ecosystem and in the environment at the personal level.
Right. Well, Dr. Sensenig, I appreciate you taking the time to do this today. Is there anything else you want to say about the upcoming Vital Gathering or the healing power of nature?
I think so. With respect to the Naturopathic Medicine Institute, we're doing a gathering next week, 2 weeks from now, a week and a half from now. I can't even remember the dates exactly, in Phoenix, Arizona. And yes, if you are a naturopathic physician who's listening to this, or a naturopathic student, and you care about the profession and you care about preserving the wisdom of our elders, if you care about understanding medicine in a way that is, in my opinion, more effective and has more potential than allopathic approaches to medicine, then you need to be there. And you need to join with us in building a community of physicians and practitioners who understand these vital principles.
Well, thanks, Dr. Sensenig. I'll make sure to link to the event as well as your practice in the show notes. I think we're just about out of time here, so if you want to learn more about the Naturopathic Medicine Institute, head on over to naturopathicmedicineinstitute.org. At the NMI, the laws of cure are seen to be immutable, and the healing power of nature is acknowledged, discussed, unpacked, and celebrated. Thanks so much, Dr. Sensenig.
Thank you, Ben.